Hi, everyone. I'm Mandy Gross, and I'm going to be talking a little bit today about patient briefs. Um, Often, the concept of a patient brief or debrief or event recap or pre-discharge care discussion is confusing, including what it's even called to the people in the medical field. There's no consensus about what to call it, and also no generally accepted principle of what to include. There is the notion that debriefs are only for discussing what went wrong or what have gone better, but that's not the case. To a patient, this actually may be the only time that they'll be able to understand what actually happened and a time to create a plan of action for the rest of their lives, so no pressure. They may have, in fact, been so caught up in the care plan, medications, and other things happening around them that they don't even know what happened to them. Many providers report that they're doing Many providers report that they're doing a patient brief, but patients are reporting that they're unaware of having received one. So, we're here to maybe try to close the confusion and get everyone on the same page. An important thing to understand about patient briefs is that they're neither admissions of guilt nor are they a way for people to blame the doctors and nurses. It is a moment to pause, discuss, and understand what's happening, getting everybody back on the same page. These briefs can be short but meaningful. It's usually a good idea to maybe start by assessing where the patient understands about what their own care has been. Ask what they think happened and be careful to not interrupt or correct until they're done. Then you would do your part of the brief, which is a summary of events, treatments, and medications in lay terms. What actually happened, making sure that you state the diagnosis. It does seem obvious, but it is not only always the case. I had a friend who had a hemorrhage, and she was not informed about the hemorrhage until a lactation consultant read it in her chart and asked her about it. Um, Make sure that you talk to them about their medications that they received and any medications that will be long term. Also, the side effects. It seems that it would be obvious maybe that people can't drink alcohol on certain medications right after having a baby, but it is not, and some people would need to be told that. Also, other things that wouldn't seem to be mentioned, like grapefruit juice, which could have side effects with certain medications, should also be mentioned. It's also very important to reiterate that in the cases of hemorrhages and preeclampsia, there's generally nothing that could have been done to prevent it. It is not the patient's fault. We're all working as a team together to make them better, but there's nothing they could have done, and they are not a bad mom. Ask also if they'd like information about future pregnancies or if they have any questions about their future hypertension or hemorrhage risks. Some people would not like to talk about this, but some would have a lot of questions. Schedule follow-ups with appropriate doctors and specialists with them and explain why each one is needed, especially what type of specialists you're recommending, what they do. And if you can include a list of questions that they should speak about, that would be even better. Because I've been to many specialists who say that there is no special care needed after having preeclampsia, and they don't even know why I'm there. So if I had a special set of questions from my doctor saying this is what I should be asking about, looking out for, and what I'm maybe now more likely to get medical wise, that would be very helpful. A list of who to contact for medical and mental health concerns, and of course, when they should return to the ED. A list of different doctors that they saw in the hospital and for what condition, and at their different levels of care. And always try to allow time for questions because I'm sure there will be some. If possible, you can return later to answer questions because I'm sure they'll think of some later. And also, the nurse team could be helpful in this question time as well. So it is very important that we always remember that the brief, the patient brief, should include the doctor, the nurse, the patient, and if possible, a care person. Um, the care people are the extra set of ears and an extra set of questions in the room. It is also important to note that we have to make sure that the patient is feeling well enough that they can handle this um, information, that they're not too sedated or in too much pain, and that also that their care person is not still in a state of panic from a possible issue that was just happening to their loved one. So, with all of these things being said, try to do the brief as close to the event as possible. and definitely before the person goes home. If you can do it before they're transferred to a different level of care, that would also be great because once this care team is not the main caregivers of the patient, then a lot of the information might be forgotten or not explained properly. Um, the care people are also an important part of that. People's cultures, primary languages, and literacy levels are all important parts as well. If needed, maybe visuals or translators. And another pro tip is to, I know you've heard this all before, but to try to sit at eye level so that patients feel comfortable. Even if you can't sit at eye level, make sure you come fully in the room. When patients feel you have one door literally in the hallway, it is a little disconcerting to them. I had a nurse come into my room and tell me that I had a cyst on my pituitary gland, and someone would be in to discuss it in the morning. Um, that was a little bit alarming because the person wasn't in the room to ask questions. They didn't give me enough information. It was just sort of scary. The follow up was the doctor the next morning. They came in, stood at the door, announced themselves as the brain doctor, and told me to find a neurologist. It was not the cause of my current problem. Um, Also, bear in mind that when you tell a patient to find a specialist, it's important to note that these specialists might be booking months out. And when you tell someone to find a neurologist but not give more information, there might be 2 to 3 months before they can actually speak to a neurologist. So give enough information um, that can get them to their appointment and also to alleviate any emergent concerns that the patient would have. Um, I don't remember anyone telling me what postpartum preeclampsia was. I was in the hospital completely uninformed. I called a friend's doctor husband to ask him what happened to me because no one was filling me in. He said, "Is it preeclampsia or eclampsia?" And I said, "Well, it must be eclampsia because I already had the baby." And he had to say that's not how it works. I was clueless, but no one explained otherwise. I knew it had something to do with preeclampsia, but the people around me only knew that preeclampsia was a condition from Downton Abbey, which made everyone panic because it did not turn out well for the lady on the show. So, if you need to explain things to patients in lay terms and it maybe needs to be explained more than once, it's not your fault and you did nothing wrong. Um, this is very complicated medical jargon a lot of times, and the people are going through a traumatic time. It is not that you're a failure at explaining, but rather that the patient just needs more time to understand. Um, I would have benefited from someone talking to me about long-term cardiovascular and blood pressure issues that could arise. I'm still trying to sort it all out years later. Um, Many doctors and specialists who I saw have been telling me that no extra care is needed for postpartum preeclampsia, and I'm still handling the medical fallout of all of that. Um, this all may seem really simple and obvious to you guys, but you all went to medical school or nursing school or many, many years of school to understand this stuff. And most of your patients will have never heard any of this before. I'm currently on multiple PFACs, and the other patients that I speak to after the meetings are unaware that you can get preeclampsia postpartum. I even had a ER nurse doing blood work on me recently, and I was talking about what I do, and he was also unaware that you can get preeclampsia postpartum. So you'd be surprised who could benefit from these recaps or briefs. By discussing this seemingly small thing with patients, just giving them a little brief, this small conversation can prevent years of PTSD and medical distrust. People are generally very understanding and forgiving if spoken to and treated with respect. So, thank you all for listening. And I'm here if you ever have any questions or you'd like me to go over your personal hospital brief needs. Thank you.